You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, she says nobody should be wearing a loose-fitting denture. And she also says that your teeth and gums are never too bad to have the smile you've always wanted. With us, we have Arlington's go-to implant dentist, Dr. Angelie Zamora. Dr. Zamora, welcome to the program.
Hi, Randy. How are you?
Good.
Thank you for having me here.
Now, for people that don't know your practice, like who's the typical dental implant patient? And I know you brought photos, so we'll get to as many of those as possible.
Sure.
But who's coming in for implants?
Patients who think that they are headed for dentures, who have bleeding gums, bad teeth, loose teeth, and definitely they don't want dentures. And
So these people have really bad teeth.
Yes.
That's kind of like what you see.
Yes, and definitely they don't want dentures that flop around.
Okay.
And that's why they come to us.
All right. And what's the second group?
The second group is your longtime denture wearers. And the problem with this group is once they have their dentures, they don't come back unless they have a broken denture and they want another set.
Okay.
And that's when the time we tell them what their options are instead of just having their dentures. And for denture wearers, we give them upper and lower teeth that are fixed.
That don't come out.
They don't come out.
Now, is this true? Like if somebody watching this has an upper or lower denture, and if everything works out right, they come in today, tomorrow they could have upper or lower teeth.
You bet.
They walk out of your practice.
Yes.
Is that unusual?
No, it's not. Not in our practice.
Okay, good for you.
Yeah.
Good, good. Now, were you, and I know you brought photos, but we'll get to those in a second. Are there a lot of people like either wearing dentures or heading to dentures in the Arlington area?
Oh my gosh, yeah. There's a lot of denture wearers and patients with bleeding, bad teeth, and you can fill the Texas Stadium with all these type of patients.
There's that many people.
That many people.
So if implants are so good, right? Why aren't these people with dentures or the people with really bad teeth, why aren't they all coming in to get new teeth?
For denture wearers,
what's your take?
Once they have removed all their teeth after a long time, struggle with root canals and broken teeth, now they have dentures. So to them, there's no other reason to come back to the dentist.
So they don't know their options.
No, they don't know their options, and they think that that's the only option there is right now, but it isn't. After a lifelong struggle with teeth, broken teeth, painful teeth, and they have lost all their teeth and now they're wearing dentures, they don't come back.
They don't want to come back.
They don't want to come
back. Do you
back.
still hear that, by the way? Like, no offense, doctor, but I just don't like the dentist?
All the time.
Do you have a funny comeback after all these years?
I do, actually. And I say, not to worry, I don't take it personally.
Okay, good, good.
And we have patients who self-diagnose.
What do you mean?
They'll say, you know, doctor, my dad has dentures, my mom has dentures, my siblings have dentures, so I am having dentures. But they don't know what's out there. And once they have their dentures, they think that's it, nothing else. But
isn't it true if you're wearing a denture, like let's say 10 years, you can't do this because you don't have enough bone?
Not true.
Okay.
Because there are a lot of procedures out there that you can build bone. You prepare the site so you can have implants that support teeth.
How old can you be to do this?
There is no age, really. Anyone who prefers to have the natural teeth that they're used to, that's hooked onto your head.
Okay.
So
what's the oldest patient you've had?
He's 88 years old and he's my dad.
Okay, you did this for your dad?
Yes, I did. Because
why would somebody 88 want to do this?
Because he doesn't want to give up his beef jerky.
Beef jerky, okay.
He loves beef jerky. And he doesn't want to wear dentures. And so we put his dentures locked in to place. He doesn't have to worry about getting them flipping over when he eats his beef jerky. For years, I've been convincing my dad to get implant-supported teeth.
Like how many years? Because I guess it's your own father.
Yes.
He's wearing a denture. As a dentist, you can't have your father wearing a denture.
No,
right?
I mean, I know the struggles, and I can't have that with my own dad.
Okay.
So for years, I've been convincing him, and he finally did, and he's very happy.
So when it was all done, What does he tell you? He tells you about...
He wished he had done it sooner, much sooner. So he...
Does he blame you for not talking him into it, even though you were doing it?
It's always the daughter's fault.
And so good for you. So 88 is not a problem.
No.
I think you told me, because we talked on the phone. I mean, 90-year-olds, 100-year-olds are doing this. Mm-hmm. So it doesn't matter how old you are.
No.
What about pain? Tell me about your father and pain.
He had more pain when he was wearing dentures because every time he eats, his dentures flops and it moves around and he gets sore spots.
Okay.
And having the implants lock his denture in made a whole difference.
So the photos, what'd you bring?
Oh, I brought a lot of photos.
Okay.
Here you go. Here's my first patient. He's been a long-time denture wearer for 7 years, and he never wore them. He brought them to my office, brand spanking new, because he said, I cannot eat with them, doctor. It hurts me.
Okay.
And I said, okay, so what is it that you want? He said, I want fixed teeth.
That's teeth that don't come out.
Teeth that don't come out.
Okay.
And he said he wants to date again. It's been 7 years since he had a date, and he wants to go back
That's good.
to dating.
That's nice.
Yeah. And he's a trucker, and he's always on the road, but he said, I got to make this happen for me.
Okay.
And we did his fixed teeth in a day, and I'd like for you to see him here going on a date.
Is that what so he texts you this photo?
Yes.
Saying, I'm going on a date.
I'm going on a date. And when he got his teeth, he was doing all these sorts of masculine, yeah.
Okay, okay.
Yeah.
So what does he like better? The way it looks or what he could eat?
He loves both
Okay.
because he has his social life back and he can eat whatever he wants without hurting because they're fixed.
They don't come out.
They don't come out.
So how soon could they eat?
Same day. They are able to eat pasta, ground meat, ground chicken.
So at first they what? Take it easy a little bit?
Take
and
it
then...
easy a little bit. I mean, it's a surgery. It's a full surgery, and you got to allow your body to heal. So take it easy, just like when you do any other surgeries. When you lose your teeth, there's no teeth support on your soft tissue. So you tend to grow old, look old, sad, your eyes droopy. But when you have this teeth support, everything just gets lifted.
Okay.
Lifted like this. When you smile, your eyes smile. And you can see that on his photo.
On his before and after. He definitely
That's
looks
his
younger.
Before and after.
Oh my goodness.
Yeah.
Totally different guy.
Self-confidence just skyrocketed. So what do you think? Doesn't he look confident?
Yes.
How about his age? Does he look younger or older?
He does definitely look younger.
Yeah.
Even looks more handsome.
Yes. Even the way he dresses up. When he first came in, he was just wearing your natural t-shirt, like, I don't care look. He didn't care. But after his teeth were in, he's always looking like going on a date, button-down shirt, long pants, like totally different person. Let me show you this next patient.
All right. Oh boy.
She had been suffering from a bacterial infection. No matter how much she brushes, how much she comes to the dentist, she was just losing bone, and her teeth were loose, moving, and she lost, unfortunately, the front teeth.
Okay.
And she's like dreading to get a denture. So we talked about...
So she didn't want a denture. I mean, do they come in and they actually say, look, I don't want a denture?
No.
That's why they go to you.
Yes. What they actually say is, I want something fixed. I don't want anything that I put in, take out, put in, take out.
Do you ever get excited? Like, even though they're telling you a sad story, in your mind, are you going, boy, this is going to be good?
Yes, because I know I can help them.
Okay.
I know we can give them what they want and have a change of life for them.
It's very nice.
Doesn't she look sassy?
Yeah, it definitely in this one she looks a little sassy.
The way she carries herself, the way she poses. Look at her before photo. Do you see how she smiled? It doesn't even show the upper teeth.
Okay.
Look at her after photos. You
Yeah.
see how The teeth are following the lower lip line.
So they're kind of custom made?
Custom made to a T, because we take into consideration the facial features of a patient.
Okay.
How broad their smile is, the symmetry. So in that photo, you can see how natural they're looking. And even when she smiles, you can see the sparkle in her eyes.
It's true. There is a sparkle in her eye.
Yeah.
So she could eat whatever she wants.
She's whatever
Was she having
wants.
a tough time eating before?
Yes, because her teeth were moving. Every time she eats something, it hurts her because the teeth are moving or were moving. Let me show you this next patient.
All right.
He's my Navy vet.
Oh, wow. So that, when I look at this before and after, or before photo, that's got to be unusual to have teeth like that.
No, it's everywhere. Patients just accommodated and they don't smile. They don't show their teeth. I mean, these photos were taken and we forced him to smile so that we can evaluate him.
So people get like the wrong impression of this guy.
Yes, and that's the reason why he couldn't get a job, because in his mind, he's passed up because he's not smiling.
Okay.
But he's not smiling because he's hiding his teeth, and he's always told he's mean. He's not.
So what were his options?
Definitely dentures, but that's one thing he doesn't want to have. He doesn't want to have anything that he puts in or take out. He wants fixed. He wants something closest to his natural teeth, something that's just fixed.
Okay.
And here is his after.
Wow.
Totally different guy.
I would have to agree with that. I think anybody
He's
would.
handsome. You see the confidence. He wanted two things. He wanted to get a job. And the most important thing is he wants to see his family.
Okay.
It's been years since he's seen his family, and he's been hiding. And this...
Does he tell you that?
Yes.
Like that he's staying away from like social situation because of his teeth?
Yes, he told me that during our initial visit. He shared with me why he's seeking treatment, because he's tired of being alone. His nephew's wedding is coming up in LA.
Okay.
And he just decided, I can't pass this event. And he finally just did it. And he went to his nephew's wedding in August.
I mean, this, by the way, when you look at the before and after, I'm not trying to side with you, but I think anybody looking at this, he does, because we talked on the phone, you say, well, it can make him look more handsome. I always think you're exaggerating as a dentist, right? But I think clearly this changes your look.
You know, you gotta understand what the smile can do for you. It changes everything. The way you carry yourself, your self-esteem, your confidence, the way you speak. I mean, you can see the difference. His eyes, the way he poses, everything just changes. You know, Randy, this patient is a perfect example of how people are judged because of how they smile, okay? When you have a villain or a bad person, you always put bad teeth or
Like in the
missing
movies.
teeth, like in the movies.
Okay.
And if you want to make them look goofy, you pull a tooth or you put
Like the front tooth.
Yes, exactly. And if you want someone unhealthy, you put great teeth on them. Something
Great.
that's,
Okay.
yes. And society has taught us how to associate white, healthy teeth with success, with health, with beauty. And with this after photo, you can see the change in this patient, the way he carries himself. See, with these before and after photos, you can actually pick up the person's personality. The before does not really give you the real person behind that smile. But in the after photo, it just brings out the real self of that person.
So do you think that's the future of dentistry? That, like, let's say 20 or 50 years from now, dentures as we know them today won't exist? They'll all be attached to like implants? What are your thoughts?
My thoughts are that's where we're headed, implant supported teeth, because who wants to wear dentures when you eat, they flop around, and with technology available, anybody can get fixed dentures, fixed teeth. That is the future of dentistry. Fixed teeth, natural teeth, don't come out. In our office, we actually interviewed two receptionists.
Okay.
Both are skillful. Both are pretty. One does not smile very much, but the other one has a instant smile all the time.
Okay.
You call her, yes?
Okay.
Who do you think I hired?
The smiley one.
The smiling one, because I would like to be represented by someone who's happy, accommodating, friendly, helpful, empathic. But if someone is not smiling, people tend to avoid them. And I don't want that. And same thing with patients. Patients who are with bad teeth, people tend to avoid them. But with a smile, people are drawn to them. They think that they're friendly.
So no matter how
approachable.
bad their gums are, their teeth are, but if you have bad gums, the implants will still stay in there?
You know, Randy, those are actually the patients who are a candidate for implants because the teeth are loose, they have infections, so they're not salvageable. So what do? We take the teeth out, we clean out the infection, we place implants, and we put the fixed teeth.
Okay.
And so they're back to their normal, healthy life.
Now tell me about this. Okay, so your center, I guess how implants are typically done, correct me if I'm wrong, you go to one place, maybe the imaging center, then you go to another doctor that does the surgery, and then you go to another doctor that puts the teeth on top. You do all those parts right there.
Yes.
Is that why you're able to do it faster?
What we do is we do an initial consult and we take all the imaging, we do the smile design, we bring the patient back, remove all the teeth, place the implants, and give them their fixed teeth.
So it's like a 2-day process.
It is a 2-day.
They meet you,
Yes.
you get records and all that.
Yes.
And then on the second day, they get their new smile.
Yes.
Really?
Yes.
Because I've had dentists on the show that say, Randy, it's not that easy. Is it because of training or technology?
It's both training and technology. We do digital workflow where we plan everything ahead.
Okay.
And then we bring the patient back, we do the surgery, and then we deliver the fixed teeth. When everybody comes in for this procedure, we give them sedation to make them comfortable.
Okay.
We have different levels of sedation. We have nitrous, we have oral, we have IV. It just depends.
And it's safe?
It is
like
very
IV
safe.
sedation?
Yes, we go through the workup.
Okay, okay. So what are you monitoring while it's being done? Like their blood pressure?
We monitor the vitals, blood pressure, oxygen level, carbon dioxide level.
Okay.
So we monitor everything to make sure that it's safe and the patient's doing very well and stable.
Okay, good, good. Let's take a look at the next one.
Oh, this patient.
Okay.
She came in, we couldn't even make her smile. I mean, we had to take several tries to force her to smile. And eventually she did, and she's very timid, withdrawn, always looking down like this. And the reason she sought treatment is because she said that I am a happy person, but when people look at me from the outside, it doesn't match my inside because I couldn't smile.
Okay.
Because she's embarrassed about her teeth. And so people just tend to be away from her because she's not smiling, she's not approachable.
So these teeth had to come out. Like you could not save those.
No, they were
And
all...
she would have been wearing a denture.
She would have been wearing dentures, and that's one thing that kept her from seeking treatment because in her mind, the only option she's got is a full set of dentures. But she said she's been hurting, so she's like, okay, I have no choice here but come. And so when we discussed her options of fixed teeth supported by implants, this is how she came.
Okay, very nice.
Totally different person.
It's true.
Totally different person. And
Like when she looks in the mirror for the first time, what's that like for you and for her?
she couldn't believe it. She couldn't believe it. She said that it was a lot better than what she hoped for. It's not what she really expected, and she wished she's done it sooner. And she was actually just in my office last week, and she said for her to be called beautiful is just uplifting for her. She said,
That's nice.
Yeah, she said, I'm a happy person. I want to match my inside with my outside. I want to make sure that I make other people happy, and they make me happy when they compliment me.
That's good. Now, you say, like, for example, this woman on the before photo, and we've talked about this, you say that most of these people have, like, hated their teeth for, like, 15 years.
Yes.
So they miss out on a lot of good years. Because nobody wants to go to the dentist, right?
Yes. I mean,
but when it's all done, they're going, why did I do this earlier? That's what you
that
say?
is very true, because of what we have grown accustomed to when we were growing up. Patients don't like dentists. You know, we come to the dentist, oh, it's about pain, but not necessarily. But she wishes that she did it much sooner, just like everyone else that has gone through this procedure. They wish they had done it sooner.
Now, we have to mention this. So Medicare, Medicaid does not cover this. Even the best dental insurance covers a very small part.
That's true.
So what's the answer?
Financing.
People are financing this.
People are financing this. We have partnered with financing companies who help patients get their lives back.
Okay. You have to have decent credit, though.
You definitely have to have a decent credit. And what most people do is they have a relative who help them,
Okay.
co-sign for them, or sometimes what we do is we stage it.
Okay.
Meaning we remove the bad teeth, get the implants, put you on a temporary until 6-8 months later, then
I could do it.
You can do it. Let me show you this next
All right.
patient. She looks angry, and she said she's tired of looking angry, and she said that she's always wanted to do something for herself. Her husband has not really seen her smile, her real smile, because she's faking her smile because she did not want to show her teeth. So what are her options? Full set of dentures or implant-supported teeth.
Okay.
And she did not definitely want to have a denture that floats around, that she takes in, takes out. I mean, I have patients who don't like their dentures. They hide from their husbands cleaning dentures, and they wait until the husband's asleep to remove their teeth or put their teeth in. She doesn't want that. She wants something fixed, closest to her natural teeth as possible.
So in one afternoon, she gets that?
Yes.
That's very nice. She doesn't look angry anymore, that's for sure, right?
She couldn't stop smiling. She told me her bosses told her the way she walks, she's got a skip in her steps. And she actually went to a concert because she's just more outgoing now, more confident, the way she carries herself, the way she approaches people. She's always just has that smile, ready smile.
How do they find you? Do they Google you? Is it referral? I mean, what is it? I mean, like friends of theirs had this done?
Facebook, Instagram, Google, word of mouth. We have our own patients who have been in our practice a while.
Okay. So this is like the focus of your practice, implant dentistry.
Yes.
Okay.
This is what we do, and this is what we concentrate on.
Okay. Now we're short on time, so I'm going to rush you because I know you have more photos. So let's take a look at some of these.
All right. This is a longtime patient of mine.
Okay.
And for years, I've been talking to her about implant-supported teeth, but she did not want to do it. She's not ready psychologically until it happened about 2 months ago. She walked in, her front tooth fell out, and she wouldn't want to leave the office because she's dreaded by how she looked.
Okay.
And so what we did the digital design, and this is her next day.
Okay. Very nice.
Yeah.
So that's an upper set of teeth supported by implants.
It's upper arch of teeth supported by implants. She did not need it in the bottom. The bottom had some bacterial infection, but we cleaned it all out. She's able to keep those.
Okay.
But the ones on top all had to go, and we placed her fixed teeth the next day. Here's my next patient I gotta show you.
Okay.
He's a young 73-year-old man and did not want to smile because he thinks his teeth are horrendous.
Okay. Those are his words.
Horrendous.
Okay.
Yes. So we did his crowns, veneers, and bridges. And When he smiles, you can actually see teeth. Before, he would just smile with no teeth showing
So like he smiled with his mouth closed?
all the time, but not anymore. Because now he's got teeth to show, teeth that are appealing, young, healthy,
Good.
white, Hollywood looking.
Okay.
Yeah.
We are out of time, but tell me the options. So if a patient comes in and they're of the two categories, they need a full mouth of extractions and new teeth supported by implants, or they're currently wearing a denture. What are their options when it comes to dental implants?
There are several options. The minimum is having 2 implants with a snap-on denture.
Okay.
And the next one is having 4 implants with a snap-on denture too, a little bit more retentive. But the most popular option is having 4 to 6 implants with fixed teeth. The roof of the mouth is not covered. The soft tissue is not covered. It's very slim, not bulky,
Okay.
and no lift, and very natural.
And you can eat whatever you want.
You can eat whatever you want.
Your
take
father
enough.
had this done. You
My
said
fa-
he eats beef jerky.
Yes, my dad had a snap-on 4 implant supported denture.
And he's 88 years old.
He's 88 years old.
And he can eat whatever he wants.
Yes.
But you
Apples,
don't.
corn. Oh my gosh, he
Really?
loved corn in a
Okay.
cob. Yeah.
So eating, chewing, the whole bit. What do they like
Kissing,
more? Do they like what they
dating.
could eat or the way it looks
Both.
in general?
You know, patients love both because when they are able to eat, they're more happy, they're more engaging, and they love it when they get complimented.
So the most expensive part of this procedure, we talked about this on the phone.
Yes.
It's going out to eat all the time.
Yes, going to eat out all the time, change of wardrobe to match the new you.
Okay.
Yeah,
Good.
so yeah, it could be expensive, but you know what? You got to start living.
We are out of time, but final message to somebody watching this. They're either wearing a denture or headed to a denture. They've heard what you have to say, but they're still afraid. What do you say to them?
I say, come to my office. We'll do a consult. It's complimentary. We'll do your imaging. Just know your options. We can help you.
Okay, good. I want to thank you for coming on the show. Good stuff.
Thank you.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.